outside of rooms like this, data disaggregation isn't the sexiest term. I will say that if anybody can make data disaggregation sexy, it is Randall Akey, a Rubenstein Fellow. It's been a joy to have him as a colleague here at Brookings, and I hope that we will find ways to continue to work with you. And one of the things I like about the way that this event has been structured is that rather than usually with an academic conference, you'll have lots and lots of papers with regression tables, lots of equations, and then in the last 6 minutes, once everyone's exhausted, there'll be discussion of, does any of this matter? Why do we care about this? Randy's turned that on its head, and we're going to start with what's at stake. Why does this matter? And then dive into the detail. So I'm very excited to be part of it, and I'm thrilled to play a part in orchestrating this kind of first panel. And the spirit of kind of why does this matter is going to inform the opening statements you're going to hear from each of our 3 distinguished panelists, and then there'll be a little bit of moderated discussion before we open out. And I think this question of motivation is one that we need to keep squarely in our mind throughout the day. There's a famous story about Edmund Hillary, supposedly the first to climb Everest, and he was asked, why did you climb it? And he said, because it was there. The real story, of course, is the hero is Sherpa Tenzing, but that's a different story, although one relevant perhaps to today. And sometimes economists and demographers will disaggregate data because they can, because it's there. And so actually being a bit clearer about why we're doing that, what's the intent behind it, what's the value of doing it, I think will be a useful start to the day. So with that, I'll very briefly introduce our panel. I will not do justice to their bios, but you have their full bios with you in any case. And I'll introduce them as you're seeing them from your left. So on your left, you can see Ana Gonzalez-Barrera, who's a senior researcher at the Pew Research Center. She's an expert on US immigration, especially Mexican immigration. Before she was at Pew, she was director of population distribution at the Mexican Population Council. In the center, you will see John Yang, who is president and executive director of Asian Americans Advancing Justice. He has previously served in the Obama administration as Senior Advisor for Trade and Strategic Initiatives at the Department of Commerce. And then on your right, you'll see Yvette Rubidoux, who is currently Vice President for Research and Director of the Policy Research Center at the National Congress of American Indians, also an Obama alum. She served in the Obama administration as Senior Advisor to HHS Secretary for American Indians and Alaska Natives, and as the Director of the Indian Health Service. So we have 2 former Obama administrators. Doesn't it feel like a long time ago to you, the Obama administrations? But anyway. So each is going to speak for no more than 7 minutes, and then we're going to get into a moderated discussion. And I think we're going to do it in the order that you're listed on the program. I don't know if we've discussed order yet, but John, why don't you kick us off, and then we'll do Anna and Yvette.
Sure. Thank you very much. And it's interesting because I think for the Asian American community, let me start by telling you a little bit about my organization. My organization is a civil rights organization. Our mission is to advance the civil and human rights of Asian Americans and to promote an equitable, fair and equitable society for all. So a lot of the work that I do is to ensure that the Asian American and Pacific Islander community has equity in what we're doing. Frankly, what that boils down to is making sure that our community is understood. And so I only have 2 slides just to illustrate this. When you're talking about the Asian American Pacific Islander community, what you're talking about is 60 different ethnicities at least, and over 100 languages. By definition, you know now why, for us, this aggregation is so important. If you go back to Asia, so to speak, all of our communities, frankly, would be at war with each other, right? Historically, it's not a community that got along. But it's only here in the United States that we have all been lumped together in this notion of Asian Pacific American, Asian American Pacific Islander category. And so making sure we understand what that category encompasses is important. So what I listed here, just by way of illustration, is what the different populations look like. You know, when you're talking about Asian American, the 5 top populations are Chinese, Filipino, Indian, Vietnamese, and Korean. And then if you add Japanese, those are the 6 ethnicities that are above 1 million in the United States. But then if you want to think about Pacific Islander, oftentimes that's a category that's misunderstood too, is there are so many different ethnicities, so many different cultures and histories that are part of the Pacific Islander category that we need to understand. The second slide I would offer, thank you, just by way of illustration, is why the types of data that is important to us. the Asian community oftentimes is misunderstood as using some type of stereotype around model minority or things along those lines. And if you look at the lump data, if you will, I'm not a demographer, so I use lay terms when I talk about some of the data. The Asian per capita income is actually above the average, right? The average is what, 27,000, I think it says on the screen. And the Asian category, Asians are about maybe at 28,000 or so. But if you disaggregate that data, you see what I always call a barbell. At one end of the spectrum are communities like, I'm Chinese American, communities like Chinese, Korean, Indian, that are above the average sometimes by a significant margin. But then there are communities that are really suffering. The Laotian community, Hmong community, Cambodian community. Making sure that we understand these two different communities is critical to how, for an organization like mine, we make sure we get the services to the right place. There is similar data with respect to education. There is similar data with respect to language needs. Some of it tracks the same race ethnicities. And we can certainly get into the details of that. But that's just by way of simple example of why this disaggregation is critical to us. One other aspect of disaggregation that's important for us is geographic disaggregation. And because people oftentimes, when they think of the Asian community, perhaps rightly so, they think of Asian communities in New York, California, Washington, Hawaii, right? And that's largely true. But the growth areas for the Asian community, and again, if we disaggregate, we could talk about different aspects of it. But in a lump with respect to Asian community, Asian Americans are growing the fastest in Nevada, Georgia, North Carolina, Arizona, and New Hampshire. So by percentage-wise, where our communities are growing is not necessarily where you would expect. So if you're trying to understand our community and make sure that we have a representative sample of our community, you have to sort of reach out to not just the coast anymore, but to the middle of America, to Southern America, et cetera. Pacific Islanders is very interesting as well. Because again, people think Hawaii, Washington, California. Some people understand that Utah has a large population, which it does. Where are the growth areas? Arkansas, Nevada, Arizona, let me think. I can't remember the four, Alaska, and the last one is Alabama. That's the top 5. It's 1 N and 4 A's. That's how I kind of remember that. But people wouldn't necessarily think of that unless we dive into that. And so that's why it's important for all of us to make sure, in terms of the services that we're providing, we reach out to all of those. I really want to get into discussion, so I think that probably gives you a quick overview of why disaggregation is important to us. Oh, one last thing I should say. There is, and you guys will probably hear about it if you're doing research, there is a small Chinese American community that is not in favor of data disaggregation, and they're very loud about it. It's a minority, and some people are laughing, so I think people might have caught on to some of this. Frankly, that comes back to education for them, because they have a fear that by disaggregating data with respect to Chinese Americans, somehow that will limit their opportunities with respect to admission to elite schools, and sort of such that there is a quota that is placed specifically on Chinese Americans. Again, that's a separate topic that we can get into at a certain point. But I just want you to be aware of that, because when we're talking about data disaggregation, certainly by and large, even in the Chinese American community, people favor it, but don't be scared or surprised when you see that pocket, right? Because that does not reflect the Asian American or Chinese American community. But there is that element out there that I think people should be aware of.
We're definitely going to come back to that. Thank you, John, and thank you for setting a great example in terms of time as well. Anna, over to you. You've pressed the red button. Yeah, bring it right up to you.
Okay, thank you. Thank you so much. I have also 2 slides. The first one, I'm going to be preaching to the choir. I'm going to tell you why it is important to study Hispanics. And in 2018, last year, Hispanics reached a record, almost 60 million U.S. Hispanics here in the U.S. They are today, and have been since the early 2000s, the largest minority group in the U.S. But also their demographic characteristics make them a particular group from the mainstream. They are very young. The median age of the Hispanic population is 30 today, compared to 44 for whites. Overall, their educational attainment, it tends to be very low. It's one of the lowest groups for college attainment, for example. Healthcare, they are one of the groups more likely to lack health insurance. They are also one of the groups more likely to live in poverty or below poverty. A significant minority of Hispanics are foreign-born, and this is probably something that not everybody's thinking about. A lot of people think that Hispanics are immigrants. No, most of them have been born in the U.S., but there is a significant minority that was born abroad. Also, a significant minority is not proficient in English, and they speak mostly Spanish, although we also have some Native American populations who speak their own languages and have immigrated to the U.S. So this huge increase and rapid increase that we have seen over the decades, even though it has slowed down recently, and it will not be one of the largest, fastest growing groups in the coming decades, but Asians will take that place, and also multiracial Americans will take that place. That's one of the reasons why Pew Research Center started studying Hispanics back in the early 2000s. So we've been studying Hispanics as a separate group for more than 15 years. And the reason we did this because nobody else was doing that. The government has been collecting information separating ethnic and racial groups, and particularly Hispanics, since at least the 70s. But very few people and very few organizations were paying attention to Hispanics as a separate group, and also deep diving into the characteristics within the group. So those are some of the main things that we have found among Hispanics, is that yes, they are a separate group. They are very different. When you definitely need to disaggregate overall data by Hispanics, and it's actually sometimes shocking that some surveys or some instruments do not even disaggregate by race, ethnicity, particularly for Hispanics and Asians, because of language barriers and cost issues. However, within Hispanics, there are also many differences, and some of the main key takeaways that that the Pew Research Center has found in the last 15 years is that there are two ways how you can cut the Hispanic population, and it's very, very important. One of them is by nativity and immigrant generation. So Hispanics are very different if you look at them. Those who were born in the U.S. and those who are born abroad. Those who are born in the U.S. are more likely to have higher levels of education, more likely to be proficient in English, higher incomes, will not lack health insurance. Those who are born abroad are more likely to have lower levels of education, lower income, higher poverty rates, less health insurance, etc. But it's also, for us, it's also been remarkably important to distinguish the second generation, because those who have non-U.S. born parent or immigrant parents will actually look particularly in cultural ways a lot like their parents, and they're truly a bridge between those who are third and more generations and those who are foreign born. It's truly remarkable. When we have done our surveys of Hispanics, we always find just the stark differences in terms of acculturation, language acquisition, and other ways, and even public opinion about matters. By the third generation or more, Hispanics look very much like the mainstream, while second generation will look in between the foreign-born and those who are third or more generation. The other way that it's very important to disaggregate data among Hispanics is by country of origin, because of historical patterns of when immigrants from different countries in Latin America or Spain came to the U.S. and etc. And the ways they came, these groups are demographically very different. So if this is the second slide I have for you, these are just two of our measures for our Hispanic profile. So if you see on your left, college attainment is very high or highest among those from South America, countries in South America, while it's going to be a lot lower for those coming from countries from Central America and Mexico originally. And also health insurance attainment, it's more groups who are from South America are less likely to lack it. And countries, people who come from countries in Central America, Mexico, and Venezuelans are the countries who are more likely to lack health insurance in the US. And when we talk about origins, geography also plays a very important a key component here, because the concentration by origin group in the US varies by geography. So if you look at the overall US, Mexicans make up about 2/3 of the population, followed by Puerto Ricans, who are only about 9% of the population, and then the other groups are less than 5%, most of them. However, if you look into Miami, for example, you will see that Cubans are one of the largest groups there. Or if you go into northern east coast of the U.S., like New York, Puerto Ricans and Dominicans will be the predominant groups. Or here in the D.C. metropolitan area, you will find that Central Americans, particularly Salvadorans and Hondurans, are the largest group of Hispanics living here. So those are my main takeaways and the reasons why we need to disaggregate data.
Right. Thank you. And bang on time as well. Thank you for that. Eva.
Great. Well, good morning, everybody.
Do bring the microphone really close.
Oops.
They're a little bit, they're a bit of a pain, actually. Sorry.
Can you hear me now?
That's better.
All right. Well, good morning. I'm Dr. Yvette Rubidoux, and I'm with the National Congress of American Indians. We're the oldest, largest, and most representative national organization that serves the broad interests of American Indian and Alaska Native tribes. Now, I usually also introduce myself as a member or citizen of the Rosebud Sioux tribe, but in this context, I also am a member of the other category. So I thought I'd just mention that. So anyway, why is data disaggregation important? Well, it's really important for a number of reasons. We were grateful to be a part of the Robert Wood Johnson funded effort with PolicyLink that looked at data disaggregation, and we have a full literature review available on our website. So if you need more details, you can get that. Clearly, it's a big issue for our population. We're one of the small populations, but we're about 2% of the overall U.S. population, but we're incredibly diverse. There are 573 federally recognized tribes, over 200 state recognized tribes. There's tribal citizens and tribal descendants, which is a whole other issue around data. There's American Indians and Alaska Natives who live in tribal lands, in rural remote areas, and urban areas. And there are significant differences in culture, economies, and ways of life among all of these tribes. I've heard there's over 300 distinct cultural differences. And the impact of the social determinants of health actually varies among tribes and among regions as well, and that's important to know for research. Disaggregated data for our population is desperately needed to understand health disparities, because when we do have disaggregated data, we usually are on the short end of the stick and have significant disparities. We need it to understand healthcare delivery and healthcare quality, especially because of the complex options that American Indians and Alaska Natives have. We need it to help manage our healthcare programs. We need it for tribal governance, and we need it for effective and accurate policies, programs, and funding streams, especially at this state and local levels. And especially we need it to help the federal government make sure that they meet their federal trust responsibility for the services that were promised, but unfortunately haven't been provided. The reason that the lack of data disaggregation for American Indians and Alaska Natives is a big problem is because of the way that we appear in the different data and categories. We are in the OMB categories for race and ethnicity, but it's a problem because we're usually don't show up in the data. Like I said before, we're in the other category. We might be an asterisk that says numbers too small, or maybe we're not even there at all. And it's as if we're invisible. And that's really a problem for our population. There was actually a national public opinion poll in 2017 as a part of the Reclaiming Native Truth initiative that found that the majority of Americans know little about American Indians and Alaska Natives. And many actually think our problems are solved. That's a national public opinion poll. And as many of you know, being invisible is a policy problem. How can we get our needs addressed if people don't even know that we exist? And so it's also frustrating when we say, well, could you do an oversample? And then we're often told, oh, it's too hard, it's too complicated, it's too costly. We also have a problem of definition. There's the term American Indian Alaska Native, which is the federal term. There's the term Native American, which can mean a lot of different things, and there's really a need to standardize definitions. There's also a problem with legislation defining who is Indian in federal programs and agencies, and those definitions differ among agencies, and so that can really cause some problems and some conflicts. There's also issues for tribes. Tribes are actually a political entity. They have a government-to-government relationship with the United States federal government, and they need data, but their numbers are often too small. But it's essential for tribal governance. Tribes are sovereign nations. They're responsible for governing their lands, their people, and their resources, but they need data to make strategic policy decisions for their communities. And data, again, is really essential to fulfill the federal trust responsibility. And it's also, the lack of data disaggregation is also a problem because tribes are increasingly realizing the value of data and increasingly wanting to have it. We recently did a survey of tribes that found 83% thought that it was extremely important for tribes to have access to or collect data on their tribal population for governance purposes. And then they also said 89% were concerned about the accuracy of federal, state, and local government data on tribes, and 82% of tribes were very concerned about the accuracy of the U.S. Census count for tribal data. The lack of data disaggregation is also a problem in research, where results can happen and they basically are a misinterpretation. So, for example, data is often not available, but people will do a research or a survey with one or two tribes or a couple of tribes, and then the title of the article is In American Indians and Alaska Natives. And it's really overgeneralizing, and you can't attribute one tribe's data to all the American Indian Alaska tribes. Actually, it's a pet peeve if I review an article and it does that. I'm like, but the other part is that disaggregated data improves scientific validity. The research is better quality if the data is disaggregated, and the utility of the research is better in having real solutions that will help our population. So we're promoting, American Indian Alaska Native data by race and ethnicity is the minimum standard, but geographic, tribal level, demographic, state level. We're now working on a Robert Wood Johnson funded state data collaborative with other civil rights organizations to identify opportunities to advance state data disaggregation policies. And so in summary, there's a lot of issues that I could talk about today, but I'm really glad we're having this conversation. Please help us get out of the other category and help us get the data tools that we need to help reduce disparities and to help achieve health equity for our population. And NCAI and our Policy Research Center is happy to work with you all on that. Thank you.
Right. Thank you, Vet. And thank you again to all three of our panelists for the thought and preparation that went into those presentations. We really do appreciate it. And also for all staying on time, which is great. I'm going to dig in on a couple of things before we open up. This first question, I think, is going to be directly relevant to John and Anna. I'm not so sure of that. It'll be so relevant to you, because I want to dig in on this question of generation, not just where you're from, but when you were from there, or when your parents were from there. You both alluded to that, Anna more specifically. And I'm reminded of the work actually from Raj Chetty, who Bill referred to earlier, showing that if you look at upward mobility rates for Asian Americans, for example, very big differences if they're first or second generation, huge differences, in fact. And so I think you can make a plausible case that the difference between being a third generation or even a second generation Hispanic or Asian immigrant and being, say, white and Asian American is actually greater, right? So that temporal question. And so should you be also disaggregating much more carefully on the basis of, are you first, are you second, when did you move here? Because you both hinted that that's a huge difference, and I think we all know that from the data. So in other words, cross-cut time with ethnicity. Does that make sense? Anna, do you want to go first?
Well,
you raised it?
Definitely. As I mentioned, that's one of the main key takeaways that we have had from our national survey of Latinos, is that when you are able to disaggregate the third generation from the second and first, so not only measure nativity, native-born and foreign-born, you actually learn a lot more about how, we have a particular explore acculturation and assimilation and identity issues among Hispanics, not so much demographic and economic things. We have seen, so when you partition the Hispanic group by generations, you do see the movement of like first and second generation doing a lot better than the first in terms of education and income and all this. But in terms of, you also see the language acquisition, and you see even their views about the country differing greatly. By the third generation, they're more likely to look and resemble those of the mainstream of the country. And one of our main findings that we had a couple years ago, we actually went out and tried to find a sample of people who no longer identified as Hispanic, but were of Hispanic ancestry. And we found that among people with fourth or more generation Hispanic, most of them were no longer identifying as Hispanic anymore. So, people whose grandparents were born in the U.S., but said that at some point someone down the line had come from a Hispanic origin country, or even had a parent but did not grow with that parent, most of them no longer identify as Hispanic. So this is something that nobody thinks ever about, is actually identity also changes through generations.
So, and they don't identify in a hyphenated way anymore. So I'm just thinking that, this is an observation from a new immigrant myself, is that people say they're Italian American, even if it was 7 generations ago, sometime, or 4 generations. So are you saying that you don't even get that kind of hyphenated identity drops away completely?
The Hispanic identity drops away.
So
most of them identify as whites. And when we ask them in an open question, why are you now identifying as Hispanic, even though you have this in your ancestry? They say, because most likely, because they married into some other, like, I don't know, Irish American, and then that part of the culture went out, or I just identify as American.
Interesting. Okay.
So
I'm not going to mention Elizabeth Warren. See what I did there? I managed not to mention Elizabeth Warren. See, specifically didn't. John.
Certainly for the Asian American community, cross-tabulating between race, ethnicity, and when you came to the country, sort of immigration generation is important. The other thing I would overlay onto that is how you came to the country. And the reason I say that, so there's a couple of baselines. First is with respect to the Asian American population as a whole, just generalizing, about 2/3, 65% of our population are immigrants. About 90%, 92% are either immigrants or children of immigrants. So we're dealing with a very, very young generation of Asians in the United States. I mean, obviously, you have the Chinese railroad workers from the late 1800s. You have Filipino and Japanese farmers from the early 1900s. But it really is because of the Immigration and Naturalization Act of 1965 that you see this huge wave of Asians coming over to the United States now. That's why, we are the fastest growing population at this point. The other reason why I say immigration, how you came to the United States is important, is that if you look at the recent immigrants from China and India in particular, Korea to a certain extent, many of them are coming over on business visas and education visas. So then you're dealing with a very different potential socioeconomic class. So just tabulating by generation of immigrant, I don't think will reveal as much as it would in a traditional sense, right? Because if you're looking at immigrants from Cambodia, Vietnam, Laos, those immigrants came over typically in the mid 1970s as political refugees, right? War-torn countries. So the status that they came here on and the circumstances upon which they came here were just so different, right? And that has implications through education, through obviously wealth status, through sort of even sort of in terms of dealings with law enforcement. And so I think those are all of the different variables that the more you could study those, I think that's something that we always look into, is trying to understand those a little bit more finer.
Bet, please do chime in.
Well, I know we were the first ones here, so we don't have the immigrant issue, but I do want to say
thousands generation or something.
Yeah. It kind of does impact us. If you think about my family on my mother's side, her mother was a full-blood Standing Rock Sioux woman, but her father was a first-generation German immigrant. And so our family kind of followed some of those same patterns, not because of being American Indian, but because of the diversity of our family as well. The other thing is for American Indian and Alaska Natives, there are big generational differences. My parents came from the boarding school generation, and so a lot of impacts based on that traumatic experience. There's the first generation going to college, which is, I was a sort of, my parents were a part of that, and so I ended up being second generation going to college. And based on the diversity of our population, some of the things that you see in other groups impact us as well. And so our population, even though we were the first Americans, has generational differences as well that have to be accounted for, and sort of can impact how you interpret the data.
I want to turn a bit more to some specific policy implications now, and invite all of you to think about areas of policy, specific ones, historic or contemporary ones, where either the failure to disaggregate has led to a lack of policy impact, or perhaps policies not even being directed properly, or where correctly disaggregating has actually made for better policy making. It could be in education, it could be in economic development, it could be in affirmative action programs, it could be, at this point, I'm not going to steer you at all, but I'm just inviting you to think, maybe, I don't know if you when you say, we're an asterisk, right? Presumably, if you're an asterisk, it's much harder to get certain things to happen in terms of public policy. Can you think of specific areas of policy where we benefit from more disaggregation, or where we've been hurt by a lack of it?
Right, well, the being hurt by the lack of it is too numerous to count, so I think I'll go to where it really helps, because I think it's more illustrative. Anyway, so the diabetes in American Indians and Alaska Natives. It turns out that because we had data by race and ethnicity, we knew that the trend, it was already an epidemic in the 1970s, way in advance of where it is now. We were here in the 1970s where we are in the U.S. Fortunately, there was federal data. Fortunately, the Indian Health Service was able to monitor those trends. But interestingly enough, further disaggregation by region showed that the epidemic was happening in certain places. So the Southwest was sort of the epicenter. But other data showed that other areas were increasing and at risk as well. So if we hadn't had the data by race, and if we hadn't had the data by region, we wouldn't have been able to act quickly on the epidemic. And fortunately, Congress and the Indian Health Service were able in the 1970s to pass legislation that did fund the Indian Health Service National Diabetes Program and diabetes regional area consultants. And there was legislation, the Indian Healthcare Improvement Act, that helped fund various things, so that that national and regional data was really important to show the epidemic, where you wouldn't see that if we were in the other category. But it helped further. In 1997, Congress passed the Special Diabetes Program for Indians, and it was based on the recognition of that epidemic in the data. And that's currently still is $150 million of funding each year for prevention and treatment services. I had the honor of being a part of the first group of tribal leaders and a few experts, so that's how I got in there, of determining the distribution formula for the initial $30 million of funding. And fortunately, we did have diabetes prevalence data, mortality data by region, and we also had a census data so that we could create a formula that used all of those factors to distribute the funds to where they needed to go. And also, by recognizing the differences by tribe and by region, the funding was constructed in a way that there could be local adaptation and local cultural adaptation. And that program is really successful. I mean, since it's 21 years old, the prevalence of diabetes has been flat now since at least 2011 in American Indians and Alaska Natives. The rate of new cases of renal failure is decreasing faster than all other populations. And there's actually some data that shows that retinopathy has increased in a similar fashion. So the complications of diabetes are decreasing, the prevalence is slowing, and it all started with disaggregated data. And so I think that we have better policies based on having that data.
It's a great example. It's exactly what I was after. Thank you, because it allows for more precision and hopefully more efficiency in the distribution of funds. John, education if you like, but not if you don't.
Well, sure. Well, education is an easy one in some ways because, again, sort of if you look at the national statistics, people would say, well, Asians don't have any problems with education. They're generally highly educated. They're graduating from high school, graduating from college at good rates. That's not a concern. We don't need to develop programs specific to Asians. But if you disaggregate that data, then you realize, all right, we need to think about what we're doing for the Cambodian community, what we're doing for the Vietnamese or the Laotian community, what we're doing for the Hmong community, because these communities are lagging behind. We need to develop special programs, language-appropriate programs for these communities. Absolutely true for the Pacific Islander community, too, because people forget that the Pacific Islander community, when it comes to education, also in terms of high school graduation, college graduation rates, are lagging behind that national norm. And talk about an asterisk again, Pacific Islanders oftentimes, unfortunately, fall into that category. So that's an easy one. And then we could even talk about sort of, for me, it's interesting. We were talking a little bit about affirmative action because I'm going to speak at a panel on affirmative action a little bit later. Affirmative action is another reason we need to disaggregate data because people say, well, Asian Americans shouldn't support affirmative action. By golly, we do. We do because there are people in our community that are not getting that equity that they deserve because they would not be allowed to consider their race, right? And so sort of talking about it in terms of communities that are being left behind, that are not being able to tell their whole story is important to be able to go through all of that. I'm going to stick this in here because I'm not sure if it's going to come up. We're among friends here on this, I think, which is we need to always remember to think about disaggregating with respect to the MENA category. Middle Eastern, North African, right? I know a lot of people in this community were supportive of trying to get that category in for the census. We thought we were there. We didn't quite make it, but we got to make another run at it because that's another community that's being rendered invisible because of the lack of disaggregation.
Can I just push you a bit on the education point because it's a good example. You can say if you take the lump approach, like you, I like that term, lumping Asian Americans together, no need for specific programs or let's say even an affirmative action program. But what you're saying, if I understand you correctly, is if you disaggregate the data, there are some Asian American communities that really are struggling and do need more help and maybe would qualify for some kind of affirmative action program, which is maybe why some people resist that disaggregation. If you take that to its logical conclusion, one could apply that to other groups as well. So rather than just having affirmative action, say, for African Americans, you would have affirmative action for African Americans who have not arrived in the last 2 generations or something. So they're more clearly descendants of slaves. Because you could say new African-American immigrants are actually doing quite well, which if I read the data correctly, they are doing reasonably well. And so you could start to disaggregate further and say it's not just that whole racial or ethnic category that get help, it's specific groups and you slice and you dice and you start saying, well, it's actually black Americans who've been here for a long, or what, you get my point. And that could be a natural extension of what you just said about Asian Americans could apply to black or Hispanic Americans too.
And we should probably make a distinction here, right? Because, and perhaps it's always dangerous when you inject affirmative action because it's oftentimes in some ways a hot button issue. But really if you understand affirmative action as an education policy, it's making sure that you can consider race to address any inequities in the system, because we all know that that admissions process is not completely equitable. There are so many different factors. And so when I talk about affirmative action, I'm talking about it in that form. It's not about adding points. It's not about quotas or anything like that. And so you're right. I mean, part of the data is absolutely how do we consider the whole person? And socioeconomics plays a part of it. Immigration status plays a part of it. But race, ethnicity plays a part of it, and so that's. But
it's not the only part of it. It's the point you're making, and
absolutely.
You can disaggregate further. Okay, thank you,
yeah.
Anna. Any thoughts on good or bad policy stories? disaggregation.
Well, Pew Research Center does not do any policy
That's true.
work. However,
But you're among friends, so
I'm among friends.
Go for it.
Well, I do remember my summer research before I came to Pew, when I found I was studying health of Hispanic Americans, and I remember this very popular paradox of Hispanics, right? That Hispanics, even though they have all these demographic characteristics that link them to lower income and should have bad outcomes in terms of health, they seem to have to be doing better. However, the more and more I delved into the study of this, I realized that what probably was really happening is that the data wasn't there, that there was not enough disaggregation of the data to figure out if, for example, immigrants were going back home when they gotten sick, right? And were not staying behind. So you were not counting them once they were sick. Only those who were healthy were still in the country. Data was not, a lot of the data sets or statistics I was looking at, they did not disaggregate by Hispanics. Some of them only were able to measure Mexican Americans, for example, and others just did not disaggregate by Hispanic at all. So, and within Hispanics, if you are able to disaggregate by country of origin, by immigrant generation, and when the person immigrated, I think that would be very useful.
Yeah, I think this time point and country of origin point and generation point has come out very strongly, and I think it's a good point for us to think about. In fact, I know you jump in, but actually let me put my question on the table, and perhaps you can address both the point you wanted to make on this one, and then we'll go out and take some more questions. This will be harder for Anna because there's no advocacy at Pew either, but as I said, you're among friends. I think part of the tension here is that some people would argue that in order to make progress, we should be emphasizing the similarities between different groups, people of color more broadly, in order to try and create sort of strength through unity. And that's a strong argument that's made by many advocates. Rather than emphasizing the differences within racial and ethnic categories, we should be emphasizing the shared difficulties that some of those groups face. And I think that's a real dilemma in terms of advocacy, as to whether or not you should be saying people of color, and very, very capacious category who can come together to overcome various forms of structural racism or whatever that face everybody. Or do you say, no, we're all incredibly different? Not only are Asian Americans different from Hispanics, who are different from African Americans, but there are huge differences within those groups. And it turns out that even within those groups, there are huge differences based on when they came in. So it turns out that there's just massive heterogeneity, which makes it harder to mobilize. Is there a tension there? And if so, how do you resolve it in your own mind? We'll start with you, Yvette.
I do think that there are tensions in that those areas. I think for American Indians and Alaska Natives, people are always wanting, does a policy help you that focuses on similarities with other groups versus how can you address your own differences? And I go back to the diabetes example. The reason that got passed was we did work with the Juvenile Diabetes Research Foundation and the American Diabetes Association. Diabetes was similar, and type 1 diabetes is not common in American Indians and Alaska Natives, but we were able to work across those borders, and type 1 people with diabetes need research done, and American Indian Alaska Natives with predominantly type 2 diabetes need funding and programs to help prevent and treat it. So I do think that there's a trend towards trying to find similarities in the policy arena and in trying to come up with solutions. But I also believe in sort of Professor Kingdon's framework for how do you enact public policy. You need data on the need, you need data on the solutions, and you need the policymakers to actually get it over the finish line. But you still need that data, disaggregated data, to understand where the problems are, and then the solutions can incorporate. That's the problem, is if the solutions don't incorporate us, we're left out. And so I think the similarities come along on the policy piece. The third step, which is, sort of how do we all join together towards common objectives. But I do believe that we still need the disaggregated data. And that relates to the point I wanted to bring up quickly is This issue of the U.S. Census Bureau implementing differential privacy to protect the confidentiality of the data, but it's a trade-off for accuracy and availability of data. And I know you're going to talk about it later, but I want to mention it just briefly in this context. In March, someone emailed me and said, hey, the Census Bureau just did a talk and said the American Indian Alaska Native data summary tables will no longer be available. Like, literally, we were going to be invisible again. And, I have to thank Randy Akey for jumping up and helping, and we got people together. And now we're in that fight. But while we're in that fight, we're also arguing for other small populations. So it's not just all about American Indians and Alaska Natives. We're cautious to make sure we bring up there are other small populations that will be harmed by this initiative as well. So there are ways that we can work across groups to try to get similar policy outcomes.
I love this idea that you disaggregate the data. It doesn't mean you can't re-aggregate when it comes to policy and advocacy. Yeah. Right? So you come together again around the right issues. John, did you want to comment on that?
Sure. And I think you're right. Is from an advocacy standpoint, sometimes it does become a little bit tricky. If you're starting to disaggregate, then people are starting to look at what's in it for them or sort of what their own interests are. That's true. But I don't know why this came to my mind. I have 2 kids that are 10 and 6. And I was thinking to myself, well, all right, if you take the number 24 and the number 9, they're 2 very different numbers. Nothing in common. Well, but 9 is 3 times 3. You disaggregate it, it's 3 times 3. 24, you disaggregate it, it's 3 times 8. They both share 3 in common. So now we found a way to bring people together by disaggregating that data. It goes to what you're saying about commonalities by sort of reducing, because all of us are made up of all of these different parts. Some of these parts are the same, some of them are different. Let's find the parts that are the same and work from there to build that back up.
And I don't want to put you on the spot because I know that so I will not put you on the spot. Well, I do want to put you on the spot, but I won't. Okay, let's open it up. Any questions from the audience? Just wave your hand and hit your mic. There's a button in the middle of the mic with a sort of mouth. When it turns red, and bring it right up to your mouth. They're not very sensitive.
Okay, Nunez Ponce from UCLA.
Could you bring it a little bit closer still, actually? Yeah, they're really terrible.
Nunez Ponce from UCLA, Center for Health Policy Research. It's more of a comment on your very provocative question, Richard. So I think part of it is why similarities, why differences are highlighted, and it's the same kind of discourse between equality versus equity that I'm sure like Yvette knows. It's if everybody's on the same level field starting from scratch, right? Then sure, similarities are acceptable, but they're not. They're either invisible, either because they're in the other et cetera category, or they're in some kind of lump category, or we don't understand the acculturation issues going on with this community. So I think that's why you want to have the differences. And then just another, in terms of policy, social movements is one reason why you would want to have strength of the similarities. But at this point, people aren't created equal.
Thank you. Great comment. I'll take a couple more because I think I was in the spirit of a comment rather than a question. But yeah, just here. And then pull the mic right up to you. Hit the button when it turns red. And then when you're done, turn it off again. Otherwise, your mic stays hot.
Hello. My name's Maddie, and I work in policy for OCA, Asian Pacific American Advocates. I think it's really interesting, your question, Richard, because it makes me think about mixed race people and how like we've all been talking about how the mixed race category is growing, but it also exists as this separate category from, Black, Latinx, Asian, Native American, et cetera, which is interesting because when mixed race, and I'm mixed race, when mixed race people are out in society, we're not seen as 2 or more races. Like, that's not what people see us as. They see us as Asian, or they see us as, some sort of brown, or, whatever. Like, we're constantly categorized within the other racial categories. And so I think, it just raises the question for me that, like, especially since we see that the mixed race category is growing at a really high rate, how are we going to improve the way in which we analyze mixed race data? And how are we fitting mixed race people into the categories that society fits them into for the point of analysis, while also respecting their identities and the way that they categorize themselves?
It's a great question. I'd love to invite comments from the panel on that, especially given Bill's slide earlier showing the very rapid rise in that some of these categories are just over time going to get harder and harder to sustain anyways. You see more people in that category. You know, at what point does mixed race, if it becomes more common, then even the term mixed race starts to feel a little bit awkward. So any thoughts on that, Anna?
Yeah, well, a few years ago, we actually did a survey on multiracial Americans. We found out actually they prefer the term multiracial than mixed race among some of our findings. And we did it because of this, because of the high rate of growth that we're seeing and how prevalent mixed race marriages are in America today than they used to be. So this was a very difficult, actually, to carry out, to figure how to measure this population. We made sure that we included a question where we asked them how the people outside in the street, when walking down the street, identified them. And of course, it most of the time it falls within one of these categories that not necessarily is what they identify as. But it's definitely a challenge. And for Hispanic Americans, for example, Hispanic Americans have a very high rate of intermarriage as well. And as I already mentioned in some of our findings, people who are fourth-generation immigrant or more in the U.S. today who have an ancestry of Hispanic at some point in their ancestry do not identify as Hispanic anymore. One of the other groups won out for some reason or other. And most of them identify as white now, so they are part of the bigger group now.
This, again, in the spirit of data disaggregation, if you look, there is more cross-racial marriages, but I'm quoting Bill's work here again. Very big differences by race and ethnic category in those trends, and by gender. And so you'll see very much lower rates of interracial marriage for Black Americans, and especially for Black women. When I looked at the data, the chances of a Black man marrying someone other than a Black woman is roughly twice that of a Black woman marrying someone other than a Black man. And so there are all these different complexities that get added to it, and there are sharp differences in those trends by race, I think. Did you want to respond to that, Maddie? It looks like you did. Sorry,
I just want to add something
us.
that I was thinking of that I forgot to say, which is that it's interesting that mixed race people and multiracial people are categorized in this 2+ races category, when I don't even though I appreciate that, because otherwise I don't know how I would fit myself into one category. However, I might share more socioeconomic similarities with the API category than I would with other mixed race people, right? Like, mixed race people look all different kinds of ways. And really, we don't really share anything in common except that we are mixed, So it's interesting that there is even a mixed race category in the first place. Yeah. Because I don't know how helpful it is in terms of analysis.
But what else would you do with those? Where else would you put those people? There's the question. Yeah, anything, Yvette, John?
I just want to say I hope we can treat the mixed race category with care in our analyses and in the way that we talk about it because of those issues. But and be careful not to make assumptions. I mean, we've had problems with even the distinction between American Indian alone versus American Indian in combination. People make a lot of assumptions about those categories, and they're not true. I mean, it's an individual's decision to check one or the other, and they may not fit someone's assumption of why they're in that category. So, I am descended from 4 tribes and French, English, and German. So I should be in the American Indian, Alaska Native in combination category. But I check American Indian, Alaska Native alone because that's my identity. So there's the issue of racial categories, and there's the issue of identity. And, we're going to have to probably start talking about those subtle differences about how people identify. And now there's the ancestry thing where we get a couple calls a day. Hey, I'm Native American. Where do I get my check? It's like, there's no check. So, that we're going to have a lot more conversations, I think, on race and identity as more people discover.
If there actually were checks, of course, your phones would be off the hook.
Yeah, exactly.
People suddenly claiming.
Yeah, I think there's going to be need to be more conversations about the mixed race category and diversity being an asset. We also have problems in our community of, I don't know, I guess division and sort of moral, racial righteousness about, blood quantum and cultural connection and all these other things which are not helpful conversations. We should be valuing everybody, regardless of which category they're in, and how can we have those conversations as well.
If you get to the state where it's going, are you a real X or Y? But you've also put a very interesting issue on the table, which is the extent to which if you're self-describing and identities are shifting, then the difference between the ability to pretend that these are somehow sort of stable, empirically derived categories just gets weaker and weaker. It's harder to make that, with every year that passes, maybe, which makes it harder and harder to do the research, perhaps, that we're doing in the room. But anyway. John, did you want any comments on that? Okay, good. Marcus, I think I saw you first.
Actually, you guys kind of hit on my comment. I was thinking about kind of endogenous identity choice, right, over time, and some of that identity choice might be dictated by social conditions, right? So, for a lot of people, say in my family, some of my cousins are mixed race. I mean, we're all mixed race actually, but some of my cousins are mixed race, and some choose to consider themselves white based on phenotype, in large part because they see it as kind of negative to bring up their black side in the locations that they live. Whereas when they come to Chicago, they identify differently, and so you get this this sort of socially determined identification that might change, and how that feeds back into research, right? So we're given surveys. I heard Anna talking about Pew surveys, right, and it may depend on sort of the context in which you're in, how you identify on that survey, and that's going to confound later results. For somebody like me who's an empirical microeconomist, that's scary. When I do this,
you can see your data disappearing.
Yeah, exactly.
Where will I get my regression tables from without this data? Okay. Any more comments, questions? Yes, at the back there.
Thank you. Salapanapasa, University of Michigan Institute for Social Research. I'd like to follow up on a few of the comments that were said earlier, and that is with regards to the question on race or ethnicity, given that it is self-report. And with the census 2020 just around the corner, just emphasizing the importance of that data source, because it does provide, it represents the denominator for all of our research moving forward. And one of the concerns I have, which needs, I'm hoping the Census Bureau is addressing, but for researchers, is the impact of the ancestry work, where millions of people are learning for the first time. I have a percentage.
Oh, these like DNA tests and stuff.
Precisely.
Yeah, you discover that you're whatever.
And given that the census is self-report, how that's going to affect the results of the 2020 census, where we could see spikes in our
a lot more people
OMB
saying that there are certain categories because they've done the 92 whatever it is. Yeah.
And yet that does not carry over to vital records, other administrative records, where we get which is the source of the numerator. So I'm just making this comment because, for all of us, there's this possible, you could anticipate.
You have a self-defined denominator and another defined numerator.
It's not matching.
Yeah, you're not making any of the data people feel any better right now.
No. Well, actually, I'm hoping that it is going to, basically help illuminate. Okay, good. Right. Well,
thank you for those comments. I'm just going to invite the panel to give any final thoughts. We are very close to coffee time, so I'm sure everyone's ready for a quick break, a stretch, and some coffee before we move on. But any final thoughts from Yvette, John, or Anna on anything you've just heard, or anything you wanted to say and didn't get a chance to say?
I'd just like to say thank you for all of you for being here. These are really important conversations for us to have about data disaggregation and how important it is and how critical it can be for people. I mean, I don't think I'm exaggerating, for American Indians and Alaska Natives, it can be the difference between life and death. You know, if we don't get the funding, if we don't have a policy decision or it's made in an inappropriate way, it can really impact our people. But the growing diversity of the country, I think, is a potential asset that we all can talk about. But we have to be careful of the pitfalls as well. Agreed. So thank you all for being here.
John?
Yeah, definitely. I appreciate everyone's interest because it is. At times, I think, as Richard said, it might seem like it's unsexy. Candidly, for us, our organization, anytime new data comes out, good data comes out about our community, it is so great. It really is. I mean, we really use it. We eat it up. We really do eat it up because that is vital to sort of the services that we could deliver, to the advocacy that we could deliver. You know, it's a baseline for everything. So thank you.
Anna, any final thoughts?
I'm very looking forward to the rest of today and to hear from all of you, from your expertise. And thank you so much for the invitation.
Right, let's keep disaggregating, but let's do it after we've caffeinated first. Caffeination, then disaggregation. See you in a few minutes.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.